we got a lot going on today. We're going to cover a lot. I did a lot of digging today, and I'll kind of walk you through some of the stuff that I found as far as um, kind of the scientific stuff that is published about COVID, but particularly we're going to talk about the things that were published before COVID got all political. We're going to talk about the media and kind of what they're doing a reality check. Just a lot of cool stuff. I've been digging this stuff up all day, and then we're going to finish up with a video from a podcast that I watch, and I just thought it was awesome. I saw it yesterday, and I really wanted to share it with you guys. And it all is baked around, and this video is baked around the concept of be fearful when people are greedy and greedy when people are fearful. We're going to talk about specifically what you need to know to understand the difference. So specifically, today it looks like we went down about 1,600 today. It crashed down about 9,000, but immediately went up. So it either goes up and down and up lately. So kind of follows one of the patterns that we're looking at. But specifically, we're going to look at movement today. So Robinhood went up from 37.60 to 50. So that was kind of nice. We had a nice little gain on that. That was for our little IPO stock. But the rest of it, 4%, 3%, 2%, 1%, relatively flat. And then we had AMC down. It's a meme stock. Velocity Mortgage went down 8.9%. I'm not sure if that's related or not to the eviction moratorium by the CDC, which is, by the way, an absolute joke. They don't have the jurisdiction to even talk about that. I'm not sure if that's related to that. But beyond that, we're going to talk. I guess we have some. Let's close that down. We have some patterns that we saw as far as gains today. So specifically, the number 2 stock that gained today was a casino. MGM was up there. Oil stocks were up there. RDI's movies. Every is a casino, but again, not a whole lot of movement we see there. We go to 2 days, which broadens it out. Casino, housing, casino. SIG's always really nice, but then we're down to like 1%. So just some things that we noticed there. Big drop here. Velocity went down 13%. Again, I have to think it's somewhat related to the eviction moratorium, but it's hard to say. So that being said, we'll take a look at some specific research that we looked at today. We're just going to get right to it. So I went into DuckDuckGo, and I wanted to look at the 2005 pandemic plan. And I remember reading it last year, and for whatever reason, okay, why is this not shutting down? We need to quit. There we go. And I was trying to find the one where it talked about the difference between what they did a comparison, what they recommended for cloth masks and their findings, N95, surgical masks, and no masks. But I couldn't find it, and it's really weird. So we're going to talk a little bit about that, what I found today, and what I found when I was looking up certain things, which, spoiler alert, there's going to be some shadiness going on. So specifically, we looked at the National Pandemic Influenza Plans. They always say influenza because that's like the most common candidate for a pandemic. So we went down here and we saw some planned updates. I went through here. We have stuff from '05, which I thought was going to be the right one, but I didn't see it in there. Specifically, though, we're going to go into some of these documents. This one right here is the National Strategy for Pandemic Influenza and Implementation. It talks about face masks. So specifically, we're talking, when I want to bring this up in the guise of the whole sense that they're saying, okay, well, you have to wear face masks whether you're vaccinated or not. So we're going to go back and look what they said before COVID got politicized. So I'm not looking at anything from 2020 or 2021, but we're going to go way back. And it's going back to 2005. So what they write here is the benefit of wearing, and I'm not going to highlight that, the benefit of wearing disposable, surgical, or procedural masks. And these are just the surgical procedural masks, the ones that are like high-tech masks, at school or in the workplace has not been established. Probably want to tell these mayors and governors, right? Mask use by the public should be based on risk, including the frequency of exposure and closeness to contact with potentially infectious persons. So if you're sitting here and you have type 1 diabetes and somebody in your house has COVID, yeah, that mask probably makes sense. But going to the shop, going grocery shopping, or eating, going to a mall, going to the Apple store, yeah, there's no connection. Routine mask use in public should be permitted, but not required. So any of these politicians that say that they're following the science, well, they didn't really follow it all the way to the science. They went looking for the science, but they didn't find it. So anyway, that was one of the things that we noted here. We're going to go down. to the net 3 paragraphs, the third paragraph. It says, although the use of surgical procedure masks by asymptomatic individuals, that's just everyday people going around their life, in community settings has not been demonstrated to be a public health measure to decrease infections during a community outbreak. In other words, if you don't have any symptoms of anything, it doesn't do anything, right? And it doesn't do anything to knock off the infection, whether you know it or not. Persons may choose to wear a mask as part of individual protection strategies that include cough etiquette, and that's the key thing, cough etiquette. It's designed to stop droplets. Hand hygiene, you don't want to cough on your hands, and including public gatherings. So guess what? What they're saying is if you want to wear a mask, you can wear a mask, but there's no real benefit to it, right? And we're going to actually cover that a little bit because they get really in-depth on that. So, all right. Then we go into the HHS Pandemic Influenza Plan. This was, I think, in 2006. We talked about care of pandemic influenza patients in the home. So again, it's not in a healthcare facility. It's just in regular everyday situations like the home. And it said, although no studies have assessed the use of masks at home to decrease the spread of infection, the use of surgical procedure masks by the patient during infections may be of benefit. So maybe a benefit just means it's a guess. But again, no studies have assessed the use of masks at home. So if they're going to say, oh, well, the science is there and, there have been studies, there haven't. They just said that there are none. All right, so then we're going to go down a little bit further. And it talks about recommendations for infection control in schools and workplaces. And it's really clear here that the benefit of wearing masks in these settings has not been established. These are the top experts in the world. This is all the people at the federal government. And they said there's no data on that to even say that's the case. All right, so then we're going to go down a little bit further. Recommendations for infection control in community settings. This is just in a mall, in a park, in a movie theater, things like that. All right, so although the use of masks in community settings has not been demonstrated to be a public health measure to decrease infections during a community outbreak, persons may choose to wear a mask as part of their personal choice, blah, 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 what we talked about earlier. Mask use may also be important for persons who are at high risk of complications or influenza. Just think of COVID when they say influenza. Public education should be provided on how to use masks appropriately. That makes sense, right? Okay, this is the key. So all these people that are talking about, oh, we're going to do a mask mandate, right? Because you just don't know who has COVID, who doesn't. Well, this is what the science says. People at high risk for complications of influenza, again, like I said, if I had type 1 diabetes, I'm 80 years old, or hypertension, whatever it is, should try to avoid public gatherings, movies, religious services, public meetings when pandemic influenza is in the community. In other words, don't stop everybody else from doing it, but if you're worried that you're going to get sick and you're going to die, don't go. It's simple as that. You don't want to go to the movies? Don't go to the movies. Watch something on Netflix, right? If you don't want to go to church, I'm sure you can watch it on Zoom. You can read your Bible. I have my Bible right here, right? You can go to public meetings. You can do all that stuff. But they're saying you don't shut down everybody. It's just if you think you're at risk, don't go, right? I think that makes a lot of sense. They should also avoid going to other public areas, food stores, pharmacies. The use of other persons for shopping or home delivery is encouraged. Again, they're saying don't shut down everything, but if you think it's a problem, don't go, right? Pretty simple. All right, so then we went to a study here that I looked at, the National Library of Medicine, the National Center for Biotechnology Information, pubmed.gov. This is a government website. So cluster randomized trial of cloth masks compared with medical masks. So this is what we're getting into. So you're going to wear this like cloth mask that you just made at home, or it's a knit mask, a fabric mask, something that's durable you can throw in the washer, versus the surgical mask that you're only supposed to use one time. All right, so I'm not going to go into the whole thing right here as far as like how they did it, but they had 14 hospitals in Hanoi, Vietnam. They always do it in that part because that's where all the viruses are. All right, so what they said here, conclusions. This study is the first RCT, and I want to say it's a respiratory clinical trial. That's what a randomized clinical trial of cloth masks, and the results caution against the use. And by the way, this is done in 2015, so prior to COVID, right? And the results caution against the use of cloth masks. This is an important finding to inform occupational health and safety. By the way, the cloth masks are not certified for OSHA. So if you went and you said, I'm going to go ahead and I'm going to work for a company and they're going to take mold or lead or asbestos out of a house, they're not going to let you use cloth masks because they're not even good for OSHA, even though the particles like lead and asbestos are far bigger than a virus. And it can't stop one of the big particles, it's not going to stop the really small one. Moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection. Again, remember when Anthony Fauci and the Surgeon General said it actually will give you a higher chance of getting infected. Well, that's what they said right here. Further research is needed to inform the widespread use of cloth masks globally. However, as a precautionary measure, in other words, we don't know anything, we don't have any hardcore detail studies about cloth masks. However, as a precautionary measure, in order to be safe, cloth masks should not be recommended for healthcare workers, particularly in high-risk situations, and guidelines need to be updated. In other words, they think cloth masks are garbage. Okay. All right, so then this is where the shadiness comes in. So I went and looked at some of these things, and they were talking about, they cited certain links as far as where they got the data from. And so I went back to this study, the U.S. Department of Health and Human Services Pandemic Influenza Plan, cited 2006. I thought, okay, that might be the one that I'm looking for. I can't find it. I don't know why. When I first went looking for it, I found it really easily. Why can't I find it? So I went ahead and clicked on this link, or exit notification. And there's nothing there. It's gone. Like seriously, so I'm thinking, okay, maybe it's a one-off, right? I don't want to sit here and do this video if it's a one-off and tell you something shady is going on. So then we went to the World Health Organization, avian influenza, including influenza in humans, WHO Interim Infection Control Guidelines for Healthcare Facilities 2006. Again, July 2006, around the same time. So we clicked on this link, except there's actually an whoever did the hyperlink didn't really do what they're doing. So we're going to go to here, and we're going to paste it. And it should be a PDF popping up, right? You'd think it's a PDF right here. It goes to COVID-19. Notice an entirely different link here. The link's gone. Okay? All right. So then we go to, we're 0 for 2. 2 for 2 on the link being destroyed. U.S. Department of Health and Human Services Pandemic Influenza Plan. Same thing. July 20th, 2006, same day as the WHO one. So we're going to click on HHS. File not found. 3 for 3 being shadiness. So then we're going to go to one where I found pandemicflu.gov, again, government agency link, mask guidance, HC, probably healthcare workers, right? So we'll click on this one. Notice how it changed. It's not there anymore. They got rid of that link. There's nothing talking about masks. It's just it's a masthead basically. Instead of a mask, it's a masthead. So, all right. So that's kind of shady. And why can't I find it? Well, it looks like it's been memory hold, so I'm gonna have to keep looking for that. So, but that's super shady that they would get rid of this stuff. You'd think like it's an important thing to have on there. So, all right. So the next one I went on was I went to the CDC, Emerging Infectious Diseases, face mask use and control of respiratory virus transmission in households. Different one that we have there, but they didn't memory hold this one. So you look at all these people who are on here. Neil Ferguson, who's kind of a shady guy. Zhang Gao, which is one of the Chinese researchers. Anyway, so a bunch of people who are heavily on there. So learning objectives, list of non-pharmaceutical strategies that have been examined for respiratory control. In other words, not pills, but the stuff you can do on your own. Wash your hands, things like that. So they have all these people with all kinds of acronyms at the end of their names. And we get down to the bottom. We're not going to go over all the methodology, case definitions, results. We're going to go to the very bottom. All right, did I find it? Where did that go? All right, here we go. That's where it's at. Okay. All right, I believe that's right here. We conducted a prospective clusterized randomized trial comparing surgical masks, non-fit tested P2 masks, and no masks. So surgical masks, non-fit masks, and no masks in prevention of influenza-like illness. That's what COVID is during 2006-2007 winter seasons. They go into 286 exposed adults, 143 households. You can do the math, 2 people in each one, who had been exposed to a child with a clinical respiratory illness, and they were recruited. Intent to treat analysis showed no significant difference in the relative risk of ILI, which is influenza-like illness, in the mask use groups compared with the control group. The control group is the no mask group. So let's see this again. It showed no significant difference in and basically if people put masks on, either one of the mask group and the control group. So, but anyway, so that was one of the things we looked at, and it basically just, one of the things we saw there. So from there, we go on to CDC H1N1 flu. Interim recommendations for face mask and respirator use in 2009 influenza. And you can tell by the way this page is designed, it is from 2009. It goes a long way back there. So what does it say here? In community and home settings, use of face masks and respirators generally are not recommended. And this is even N95 masks they're talking about when they say respirators. However, the certain circumstances are described in Table 1. A face mask or respirator may be considered specifically for persons at increased risk of severe illness and influenza. So what they're saying is, look, we don't recommend this at all for people at home or in the community. But look, if you got something where this disease is going to kill you as the rare exception, right? You're 103 years old, you have emphysema, you have hypertension, you have type 1 diabetes, then yeah, I think it probably might be a good idea to wear a mask because, I mean, what are you going to do? It's not going to hurt you. Use of N95 respirators or face masks generally is not recommended for workers in non-healthcare occupational settings for general work activities. Well, can we tell that to Bill de Blasio and the mayor and the all kind of people that are doing mask mandates? For specific work activities that involve contact with people who have influenza-like illnesses, such as escorting a person with an influenza-like illness, interviewing a person with an influenza-like illness, providing assistance to an individual with influenza-like illness, the following are recommended. And they talk about social distancing, keep them as brief as possible, cough etiquette. In other words, you're worried about getting sick from cough and hands and things like that. And look, if you can't get away from it, you can always wear a mask. But they said, look, we said right there, it's not recommended. So last thing we're going to talk about here is CDC. And this is a Reuters article from 2007. It says face masks may do little to prevent infection during an influenza pandemic, but wearing them might help comfort people in crowds. Do you remember when Anthony Fauci said it doesn't do anything but make you feel safer, but it doesn't actually make you safer? Well, that's what this said in 2007. So anyway, so that was one of the things, and here it said it admitted that no one has done the research to show what good, if any, surgical mask style would do in stopping the spread of a virus. Experts say a flu pandemic is inevitable. Duh, just think of COVID when you say that. But anyway, one of the things that was in there. So with that being said, we're going to talk about some misinformation. We're going to close out the video today. But before we get to that, we'll close it out with this. So I'm going to show you a little bit about some of the things that I did, and then we're going to finish it out. So specifically, we added some limit sell orders in. I saw AINC. We're getting close to the amount that we bought it for. So I have 500 shares of it. If we look at it right here, I have 500 shares. Bought it for about 9,000. We're close to about 4% down. So I just thought, okay, we're not going to sell the whole thing. We'll sell half of it. Signet Jewelers, we have 66 shares of it. I just figure if it gets up to 75, one of the things that I looked at for Signet Jewelers is it's getting close to a 10-to-1 payout, basically. So around that, I figure it's a good chance just to sell that off, take the profit, and kind of reinvest it. I don't think it's going to go super higher than that. And then Corsair, 310 shares. We're selling 310 shares. We bought it for $30.77, and we're getting close to the sell point on that, so we're 11% off. So I said, okay, if it gets to 31, we'll just sell it off. And between those three that we're adding on here, we're basically clearing about $19,000 to free up cash and to reinvest if we want to do that. All right, so that being said, I almost forgot about that. My apologies on that note. All right, so we're going to watch a podcast that I have called Breaking Points. It's about 14 minutes. We're going to close off on this. But one of the things they're going to talk about on this is they're going to talk about the role in the media of ginning up this panic that doesn't even exist. And specifically what they're going to talk about is the fact that, and this is, I brought this up in the last video on how everybody in the federal government is like, or the federal government as a whole, not everybody, but the federal government's sitting here going, oh my gosh, you know, all these things are going on. Even if you're vaccinated, you should wear a mask. And it's just killing any reason for anybody to get vaccinated. Like, why would you want to get vaccinated? Like, I'm going to have to wear a mask anyway. Like, there's nothing I can do that when I'm vaccinated than when I'm not vaccinated if you do this. And so specifically, they're going to talk about what happened in Provincetown, which I think is in Rhode Island. They had a study, the CDC thing, where they recommended masks for vaccinated and unvaccinated coming out of Massachusetts. And they're going to talk about some numbers that you need to know and understand why that is such a red herring. And it's just a bunch of BS. Specifically, they're also going to talk about Provincetown on what happened there, because it was quote, a huge breakthrough, outbreak of breakthrough cases in Provincetown. But when you hear the answer, you really want to stick around for this. When you hear what caused that outbreak, it's going to make all the sense in the world. And the reason we bring this up is because we always say that we want to be fearful when people are greedy and greedy when people are fearful. Well, people are being really, really fearful right now, and this is a chance to get greedy. And realize that one of the things they're finding in England right now is this: if the Delta variant lasts about 6 to 8 weeks on average. Most spikes last about 6 to 8 weeks. So we're just going to weather this right now, buy what we need to buy, lower our cost basis, and get ready to make a ton of money. And with that being said, I always talk about sports betting starting, the Hall of Fame, HOFV, the stock that we have. Where is this at here? The stock that we have right here, the Hall of Fame resorts. The Hall of Fame game's starting this week, guys. So football season will be slowly building up over time. So we should see that sports betting payoff start soon. So anyway, with that being said, this was an absolutely phenomenal video. It's about 14 minutes. I definitely encourage you to take a little bit of time to watch it. They can say it better than I do, but it's just a perfect analysis on why you shouldn't listen to the fear porn the media is saying, and you should actually start investing. Again, remember that they don't have Trump anymore, so they need to gin up something in the summer months to get ratings, and this is exactly what they're doing. So Sagar and Jetty and Crystal Ball, they have a podcast called Breaking Points, and I definitely recommend you subscribe if you haven't already done so. All right, here we go.
The media's job is to tell you what's going on. And some people, for reasons I won't understand, still really trust the media. And they look at them, and the media's telling them, you should be really afraid. Now the CDC is bringing back its mask mandate, and I think there's a lot of problems with that. But still, you know, it's the CDC. It's like when you see it in a movie, you're like, I'm supposed to trust it. And we are seeing a total and complete breakdown of reliable and good information coming from the CDC, coming from the media, so much so that we have a total and complete cluster. Let's throw this up by the Mediaite, because I thought they actually did a pretty good job here. NBC News, the New York Times, and the Washington Post all independently called out on the same day for horribly irresponsible framing of COVID cases in fully vaccinated people. And let's give you an example. Ken Delanian, who is a world star idiot over at NBC, CIA scribe, decided to start writing about COVID. So here's what he says. Exclusive. At least 125,000 fully vaccinated Americans tested positive for COVID. Oh my God, that's scary. 125,000 out of how many? 145 million? 150 million Americans? It's one of these things where when you think about it statistically, you're like, wait, that's actually nothing. Also, how many of those people got hospitalized and died? Oh, so you have a 99.999% chance of survival from any sort of breakthrough case if you're fully vaccinated, and you have a 99.996% chance chance of not being hospitalized, oh, that sounds pretty good odds to me. These people are basically trying to scare someone for no reason. The same thing happened at the Washington Post, which is their headline was essentially the same thing. They said, quote, CDC shows 3/4 of people infected in Massachusetts COVID-19 outbreak were vaccinated. Now, once again, they point to vaccination rates and even the cases without talking about hospitalization and death. All those people in that Massachusetts story, none of them died. 4 of them were hospitalized out of hundreds.
And by the way, this was an area with very high vaccination rates. So guess what? If there's very high vaccination rates, then you're going to have a high percentage of vaccinated people who are the ones getting it. That does.
All right, so this is the key thing that we want to really latch on to. It's not like you have 50% of the people get vaccinated, 50% aren't, and then you get a whole bunch of people that are getting the, hospitalized or getting testing positive are all on the vaccination side. What they're basically saying is that everybody in this area is vaccinated. So when you have a breakthrough case, guess what's going to happen? They're all going to be vaccinated. It's a total sampling, error that any complete beginner statistician would understand is a bunch of crap.
Doesn't mean the vaccine doesn't work. And it's all intentionally scaremongering.
It's pure fear-mongering.
For profit. Yeah. Fear-mongering for profit. And it is the best gift that they could ever give to anti-vaxxers.
Yeah. That's the worst part. And I want to show you how bad things are. The White House is calling out the New York Times. So put this up there and keep it up for a little while. Ben Wakana, this guy is the strategic communications director for the White House COVID-19 task force, quote tweets the New York Times for those who are listening. The New York Times says the Delta variant is as contagious as chicken pox, may be spread by vaccinated people as easily as the unvaccinated. And Ben really points out in all caps, vaccinated people do not transmit the virus at the same rate as unvaccinated people. If you fail to include that context, you are doing it wrong. So things are so bad that the New York Times is exaggerating so much that the White House itself is saying, all right, everybody, hold on a second. Okay? That is the level of insanity that we've reached. And so I alluded to these figures, but let me underscore them. Please throw up Andrew Kaczynski's tweet. Less than 0.1% of vaccinated Americans have been infected with COVID-19. 0.004% have been hospitalized. 0.001% have died. So let that sink in. 99.6% chance, 99.996% chance not being hospitalized, 99.999% chance of not dying. The people who are dying, who've been vaccinated, mostly people severely immunocompromised, had a lot of the problems going on. So, and most of them are elderly too. So already on the brink, comorbidities. Everybody knows that side of the story. This is what bothers me the most. The media is essentially saying, and trying to build the case for the mask mandate and all this by undermining the case for the vaccine itself.
Yep.
If you're unvaccinated, and I have a whole monologue on this about who are these people who are not vaccinated. I went and I dug into the data from the Kaiser Family Foundation. The number one reason for not getting the vaccine is it's too new and I'm gonna wait and see. Now, if you're in the wait and see crowd and you're not hearing this responsible reporting around dying and infections, and you're seeing, oh, I can still get infected with COVID, and the media is not telling me that infection is not the same thing as hospitalization and death, well, why the hell am I going to get this vaccine? Yeah. I'll just get COVID and have the antibodies or whatever. And it's like, guys, they're blowing a massive hole in this, so much so that even the White House, who I think has gone way too far in embracing some of this public health guidance, even they are saying this is a total disaster, how the media has handled themselves this weekend.
Yeah, because their interest is in people feeling pretty good about the state of the country and that we're on the upswing, and that is the truth of the matter. And you're right to say, look, this is a scary moment. People are trying to figure out what's going on, what the risk is to themselves, going through this whole process again of reassessing, like, okay, where am I going to, my kids are going to go and play, what's going to happen with school open, all this stuff. Like, I get that is very fraught and very tense, and this crap makes it all so much worse. To me, the most irresponsible one was the framing of this Massachusetts study and just putting out there without any of the surrounding context that more vaccinated people were getting COVID than unvaccinated. If you're just looking at that as just a headline, you're thinking, wait a second, so if I get vaccinated, I'm more likely to get coronavirus? That is the polar opposite of reality, and we know that that is the case. I mean, we've had how many hundreds of millions, possibly billions of people worldwide who've gotten this vaccine now. We know the data around what happens. You are dramatically less likely to get COVID. If you do get COVID in these rare instances of breakthrough cases, you are even more dramatically less likely to be hospitalized, and the chance of death is as close to zero as it could possibly get. That's the story. The story is the vaccines work, and all of these people scaremongering for profit and clicks should be completely ashamed of themselves. And by the way, hey, Twitter, where's their, misinformation label? Where's their ban? Where's them being entered into the, dystopian social media database where they all coordinate to give you the internet death penalty? Where's all of that? They jumped to when there was like some bad Hunter Biden story before the election. But this stuff coming from sources that are considered so trusted is completely disgraceful. And it also really does show you the double standard, because if some, right-wing nut job on YouTube had put this out, they probably would have gotten their video would have been 100%. Demonetized, taken down, possibly kicked off Twitter, all that stuff. But because it's the Washington Post, New York Times, NBC News, they're just like, well, it's not great, but whatever.
Think about that Washington Post headline. Think about the Washington Post headline. Imagine some anti-vax guy on YouTube. He's like, you're more likely to get it if you get the vaccine than not. YouTube would look at that and be like, hey, this person is... It's the same thing. Mm-hmm. It's the exact same thing. It just so happens that these people are establishment. Also, I just want to say, by the White House's own standard, these people should be removed from all of social media, right? They've been spreading COVID-19 misinformation. They shouldn't be on Twitter, by all rights, by Twitter's own standards. Twitter should have taken that down, or at the very least labeled it misinformation, but they're not going to do it. And I would be remiss if I didn't say this was happening at a time of terrible ratings for the media. Frankly, Delta is the best goddamn thing that ever happened to them. They miss Trump so much. Yeah. They have been trying to make him happen. It just refuses to start. They try on CNN, all of this. Delta is the best thing that could have happened, because now they need to gin you up so you have a reason to watch again.
All right, so I thought they were going to talk about the whole Provincetown thing. So actually I realized it was on the Ben Shapiro thing, so we're going to talk about that right now, where they talk about exactly what happened there. And again, this was one of the things that they used as an excuse to try to push companies and try to pursue a mask mandate for people who are vaccinated and not vaccinated. So anyway, we'll end on this.
It also leads them, by the way, to ignore all sorts of relevant data in pursuit of zero COVID. Like, for example, what you end up with is this
All right, so I thought that thing about Provincetown was in a prior video. It's going to be in this one right here, so we'll wrap it up here. And this was a video that Ben Shapiro did yesterday.
Stated assumption that they're going to get to zero COVID, which of course is never going to happen. It is not happening. They will not be getting to zero COVID. It also leads them, by the way, to ignore all sorts of relevant data in pursuit of zero COVID. Like, for example, they're taking this Provincetown situation as though this ought to be indicative of public health for everyone else. Okay, Provincetown is the case the CDC mentioned as how vaccinated people are passing this thing at extremely high rates and they're getting super infected. There's only one problem with that, which is that Provincetown is a wild statistical outlier. In Provincetown, 85% of the people who got COVID were male. The reason, that right there should tell you it's a statistical outlier. Why? The reason is because Provincetown, apparently over July 4th weekend, was basically gay party zone, because Provincetown is a very gay town. And a lot of people, according to gay rights experts, were basically going up there and macking on each other. It is very likely that you're going to pass COVID. Much more likely you're going to pass COVID if you have even if you're vaccinated, if you are swapping spit with people, than if you're not swapping spit with people. It's not the same thing as going to a restaurant or sitting 6 feet from somebody else in an office.
All right, so anyway, good thing to end as we end the video today. If you have any questions, let me know. But again, this just shows you that there's a lot of hysteria going on. There's panic going on. It's not grounded in anything. And this is the time where you want to be greedy, when people are fearful. To get more information on the sales cheat code, go ahead and click on the subscribe button below. Also, down below in the video description, down there, there's a link that takes you to our website that gives you additional content, some additional freebies that we have, and gives you information on some programs that we have that have been proven to help people, to make sales easy, so that you can make the kind of money you want, live the lifestyle that you've always wanted, and not have to struggle in the process. And what might be the coolest thing of all is you don't have to put much effort into it. It truly is a cheat code that most people don't know about. And it's a cheat code that can change your life today. So click on the link below and let me help you start to experience these results starting right now.